Thank you for joining us for our weekly telephone town hall. My name is Zoel Stackhouse, special assistant to the Deputy Chief of Staff of Mayor Muriel Bowser. Today, our telephone town hall is going to be centered on the District of Columbia Public Schools Term 3 reopening. So I'm going to pass it on over to the Chancellor. Chancellor?
Good evening. Thank you for joining us. It is my pleasure to talk a little bit this evening with my colleagues about our reopening for schools for Term 3. Tonight, I am joined by our team members. Our Chief of Operations, Patrick Davis, is with us, and then Dr. Brent Elliott, who is our School Improvement Supports for DC Public Schools. These two individuals will lead in the discussion tonight along with myself to share more with you about our plans for reopening for Term 3. As we talk about Term 3, it's important to note we are referring to the third term of the school year, which begins on February 1st, and we're currently now in Term 2. Go to the next slide. It's important to remind everyone that as we think about our Term 3 plans, DCPS has really taken a grassroots approach to its planning. We've had the opportunity to establish what we call reopening community cores at each of our schools, and each of the teams have been designed to be diverse and reflective of the school community, but they also had a specific charge as relates to developing a reopening plan that is customized and tailored to the needs of their school community. The plans were developed with some guardrails that were provided by our central service teams that reflects best practices for reopening. And of course, all of our reopening plans reflect our health and safety protocols. There were two key questions that were asked of the reopening community core that we wanted them to respond to. And the first was, what is the best instructional model for your school? How can that instructional model meet the needs of the students and families in that community? And then the second question was around grades and classes. What is the best way to organize classes for each grade level to support in-person learning? And also, how might our care classrooms be offered in Term 3 as well for those students that prefer our care model? And so those were the two key questions that each school was provided. And then we gave them a set of models to work from. So on the next slide, you'll see an overview of the 4 models for our elementary schools. There's Model A, Model B, Model C, and Model D. Model A is designed to have one teacher serve a group of students. This can be done approximately 4 to 4.5 days per week. And one teacher is responsible for a cohort of students for Model A. Typically, a cohort at the elementary level would be up to 11 students per classroom. For Model B, there's still one teacher, but the teacher instructs students both in person and remotely. And the virtual instruction can be supported by support staff. In this particular model, technology could also be used for what we call simulcast. So the teacher could be teaching virtually or in person, and students can view that teacher at home or in school. The majority of our schools have some form of Model B in their reopening plans. And then Model C requires schools to utilize 2 different teachers. So a teacher may be responsible for a cohort of students on Monday and Tuesday, and then that same cohort could be with a different teacher on Thursday and Friday, or 2 cohorts could be split among 2 teachers. The idea here is to ensure that content areas are split among teachers at a particular grade level or classroom, and this allows students to go deeper in schools that have a focus, for example, on STEM or language learning. The last model is Model D, where one teacher instructs 2 cohorts of students. So you have one teacher that will have a group of students on Monday and Tuesday, and then that same teacher could have another group of students on Thursday and Friday, or it could be an AM or PM model. So for example, the students could be with one teacher in the morning, There could be a transition in the middle of the day, and then the teacher could be with another group of students in the afternoon. And so again, that's a recap of all of the 4 models. However, we gave schools the ability to color outside the lines somewhat in these 4 models. And so if a school wanted to combine any of these models or use one model for one grade level and a different model for another grade level, they had the flexibility, again, to tailor and customize the models to the needs of their schools. So to give you some numbers of directionally where schools landed on their model, we have about 44% of our schools that have some form of Model A. We have about 63% of our schools that have some form of Model B. And then about 24% of our schools are utilizing some form of C, and then 33% for Model D. And then this, again, is for our elementary schools, grades pre-K through 5. We go to the next slide. I'm going to speak a little bit more to our secondary schools. So this is specifically for schools that serve students in grades 6 through 12. The model here are a little bit different because typically at the secondary level, the student will have multiple teachers and they'll have multiple teachers per day, and that could change each semester. So we've created a model where students could be in and out of the school building and learn in person or remotely at the secondary level with a focus either on high needs or academic support or social emotional support. So for Model A, it is focused on high need cohort. So this would be focused on a smaller group of students that will receive academic support, and this could occur either 4 days or 4.5 days a week. Option B is based on a cohort of students for high demand, and so for here, the goal would be to serve more students, and it could be organized by common needs among students. And typically in this model, instead of 4 to 4.5 days a week to serve more students, schools would serve students approximately 2 days a week. So it could be a Monday, Tuesday for one cohort, and then a Thursday, Friday for the second cohort. Option C for our secondary school is driven by either course or teacher. So students are coming together if they have the same teacher or in the same class, or if they share the same courses. So for example, a student may have the same teacher for biology and the same teacher for algebra 2. They may come in and have in-person learning with those 2 teachers as a cohort of students. And then finally, option D is based on academic and social emotional supports. And this model, typically students would come in maybe 1 day or half a day, or they could come in several days throughout the week to receive specific supports for academics or social emotional support. The social emotional support would typically be a situation where students would come together with their peers and have time that is facilitated and guided by an instructor or a teacher in their grade level or in their school. And so those are the 4 models that are being utilized at our secondary level. And to give you a flavor, majority of our high schools and our middle schools are utilizing option D. However, across our secondary schools and our elementary schools, we will have in-person learning, and we'll also have cares being continued to be offered at the elementary level as well. So we go forward to the next slide. Here are our health and safety commitments. As I mentioned earlier, in addition to providing the flexibility around the learning model, we remain focused on our health and safety commitments. And to share more about these health and safety commitments and how they will be represented in both our elementary and secondary schools, I'm going to turn it over to Chief Davis, who will share a little bit more about what families and students and staff should expect in our schools.
Great. Thanks a lot, Chancellor, and thanks for joining us this evening. I've really viewed our work as operationalizing the health guidance from our partners at DC Health, the CDC, and our education partners at OSSI. Obviously, they've done a tremendous amount of work to outline health and safety parameters for the city, and they've developed educational guidelines that we've been following, and we turn those guidelines into operational plans for our schools to follow. and they're summarized in these health and safety commitments. So I'll go through some of these in detail and then a few more slides, but happy to take questions as well. The Chancellor mentioned cohorts. One of the key principles in all of our return planning is maintaining cohort integrity. So kids will come together in school, and they'll be in small groups, and they will stay with that small group throughout the entire day. This allows us to, socially distance properly in classrooms, but it also helps us control the spread of any virus that may occur in the building. Next, you'll see, and just like you're doing in the street, and around your house, anywhere you're going, in the stores, we're going to require PPE. So we're providing robust PPE for all of our staff and students. So we've provided enough PPE to our schools so that every staff member can receive a new mask per day, and the same thing for our students. Our teachers will be provided face shields if they choose to use them, and then there are select positions across the school that may receive enhanced PPE, including gowns, shoe covers, and things like that. Next, we've been working with the operational folks at our school to make sure we're doing enhanced cleaning throughout the building and really focusing on those high-touch areas. So any doorknobs or buttons, really anywhere that hands are going to be throughout the day, we're going to have a continued focus throughout the day to make sure those are cleaned per the CDC recommendations and guidelines in terms of how to clean and what to use when cleaning. We're following all those recommendations. Along the lines of our classes, one of the key things we're doing is actually limiting transitions. So as the Chancellor mentioned, typically in a secondary school, you go from period to period, or elementary school, you go from your homeroom to art or science or music. We're actually reducing a lot of that to maintain that cohort integrity. So kids will, for the majority of the day, will stay in their classroom with that small group of cohort and classmates. Next, I mentioned the socially distant arrangement, but obviously our classrooms are going to look a lot different. We've got a really dynamic environment in our schools, but we've now incorporated some health and safety guidelines in that. So you'll see social distancing in all of our classrooms, all of our offices, and you'll see visual cues throughout the building so that students and staff are reminded of the importance of social distancing. You'll see tape on the floor and markers on the floor so that we're reminded of all the social distancing requirements. Next, as you bring your student to school, your child to school, you'll notice that getting into school is a little bit different. There's going to be a number of screening steps that students and staff have to go through to get into the building. This includes getting a new mask, hand sanitizer, getting your temperature taken, and going through a process with health professionals to get a daily health screening to make sure that anyone that's entered our building is feeling well and ready to learn. Dr. Elliott will share more or knows more, but we're doing a whole lot in terms of screening. I mentioned the screening steps to get into the building, but we're evaluating on a daily basis with our partners at DC Health to make sure that we're screening and reporting all necessary symptoms, any potential positive cases, and working closely with our partners at DC Health if there are any instances that we need to evaluate and escalate. Next, I mentioned kids will stay together in their small groups. That is again geared towards keeping those kids together, but also reducing the number of people. Obviously, for any large group setting, there are restrictions in place, and there's no different for schools. And one of the things that we do that brings the most kids together is typically the lunch in the cafeteria. So again, to maintain that cohort integrity and make sure that group of 10 or 11 students remains with each other, we're actually going to be changing our dining habits and actually eating in the classroom. And next, we've had a full day of professional development today and throughout the previous months, working with operational staff and all the other staff to make sure they're trained and ready to support the new instructional approach. And then finally, as the Chancellor mentioned, we're still providing a virtual option. So if families still decide that it's the best option for their child to remain at home, we will continue to provide a virtual learning opportunity for all students. Next slide. One of the key things that we're doing is doing a significant HVAC enhancement. Before I dig into the details of the HVAC work, it's always important for me to remind folks that HVAC is typically something that gets a lot of attention, and it's an important aspect, but it's just one of the health and safety measures that we're implementing. We had some doctors on our professional development call this morning that really shared that the importance of layering and factoring in all the things that we're doing. So social distancing, face masks, the HVAC enhancement, all of these things work together in tandem to make sure we're creating a safe environment. So I'll go through this in detail, but this is not the only thing we are doing to keep people healthy and safe in our buildings. But we've made a significant investment thanks to Mayor Bowser and her commitment. We've invested a little bit over $24 million to improve the air quality in every single one of our schools. And this was done in consultation with national experts to understand what measures need to be in place in order to improve the air quality in our buildings to reduce the risk of transmission of the virus. So every single school has received a tailored and school-specific plan. So no matter what school you're going to, that school has received a significant HVAC enhancement that includes installation of MERV 13 and MERV 14 filters if there's a centralized HVAC system. That includes over 3,000 mobile HEPA filters that have been distributed to all of our schools. So every single classroom and shared workspaces will have a mobile HEPA filter, which you see an image on the screen here, but essentially it's a mini unit that gets wheeled in and continuously cleans the air at a really high filtration rate. So I shared we've done over 3,000 HEPA filters. So if you see pictures of your classroom, you see a little, what looks like a mini fridge. It's actually a unit that's cleaning the air. So we're really proud of this work, but overall we've invested over $31 million to keep our, to make sure our buildings are ready for student return and staff return. Next slide. And to show all this off, we've been partnering with our school communities to go through a robust checklist. So every single school is going through this. Elementary schools and education campuses have already gone through this, and secondary schools are completing this activity this month. And this includes a walkthrough and a checklist that's been jointly agreed upon with our labor partners to identify these are the metrics that need to be in place these are the things that need to be in place for every single school. They need to show that there's a right amount of PPE, the HVAC enhancement's been done, there's cleaning protocols, there's socially distant desks set up, a whole host of things. So every school has gone through a walk with parent representatives, teacher representatives, and the school leader to show what the new learning environment is going to look like. And all of the results of those checklists are posted on our website. And as I mentioned, secondary schools will be completing that in the coming weeks before term 3 starts. Next slide. So now I'm going to turn over to my partner, Dr. Elliott.
Good afternoon. We realize that in order to keep our schools safe and our students healthy, that this is a shared commitment. It is a commitment that we share with our families, our students, and our staff. And on the screen here, we've outlined those commitments that we have articulated to our students and their families. We ask that families send their students to school only if they're symptom-free, and that they abide by the Ask, Look protocol. And we have done training with our families, with our school staff, so folks are very familiar with that protocol. We have rolled out to our families information around our COVID testing processes that their students can participate in, and ask that they volunteer to participate in both the asymptomatic and symptomatic testing. We ask our families to complete immunization. That is so critical, that those preventable diseases that we already know about, and there is robust immunization available, we ask that our families ensure that their students get those immunizations. Our students and families are aware of the need to participate in daily temperature screening. And we have integrated the importance of the following safety processes and ask that our families reinforce these at home. This includes mask wearing, social distancing, and frequent hand washing. In addition, we asked our families to keep their students home if there's a member of their household that has tested positive for COVID. And we want our families to inform us if they are traveling to any high-risk areas where there is a greater potential for their students to become in contact with the COVID virus. And finally, we ask our families to limit entrance into our schools. So we really don't want them coming into our school building just because that just increases the risk for our students and staff. So we asked our families as much as possible to communicate with their schools online. And if they do have materials that they need to drop off or paperwork, that they do leave that at the front entrance. Next slide. We also have a very robust screening and testing protocols, and we realize that those are two very important strategies in the suite of things that we do to ensure that our students are safe and healthy. We have both asymptomatic and symptomatic testing available for our students and for our staff. We do in-school asymptomatic testing for our students. This protocol is supported by DC Health, and currently the protocol is that we have DC Health nurses that come to schools on a 10-day basis, so every 10 days they will show up to our schools, and students that have a valid asymptomatic testing consent form on file are able to participate in the testing. If we have a student that ends up with a positive result as a result of the testing, they must begin a 14-day quarantine, and that information is shared with the family as well as our school community more broadly. With regards to our staff are able to also participate in asymptomatic testing. For our staff, this happens at home. So we mail a testing kit home to our staff that are participating in-person learning. They receive that in the mail, and they're able to self-administer the test, mail it back in, and this is done at no cost to our staff. We invite them to participate in it. The asymptomatic testing protocol, it is voluntary, but we do ask that they participate because, again, that offers some added protection. When there's a positive result, that information is shared with DC Health, but also with that staff member directly, and we asked our staff members to follow up with the school so that information can be shared. With regards to symptomatic testing, if we have a student that becomes symptomatic during the school day, we have a protocol by which we are able to test that student. We have increased the role of our school nurses. So our school nurses really have a major responsibility in supporting students during the school day if they become symptomatic. If this happens, a student is escorted to our health isolation room by another staff member. We've added some additional staff members called patient care technicians who help support with our screening, temperature check, visual symptom checks, and escorting our students to the health isolation room and monitoring that isolation room. So if we have a kid that's symptomatic, they're escorted to the health isolation room. Then our school nurse comes over and does an assessment of that young person and determines what's the next step. If that student has a valid symptomatic COVID testing consent form on file, then a rapid test can be administered first, and then based on the results of that, they will follow up with a PCR test. For our adults that become symptomatic during the school day, they also have the option of having on-site testing. That testing is done through DC Health. DC Health will dispatch a nurse to our schools to administer that testing, or that staff member may choose to follow up at one of the many testing centers across the city where DC staff have been prioritized, or they can follow up with their own health professional. Next slide. I'll turn it back over to the Chancellor now to share some key dates.
Thank you, Dr. Elliott. Just a reminder to families that we're currently offering seats to families for in-person learning or our CARES classroom. And we've asked all of our schools to share their plans that were established by the Reopening Community Corps. And families should expect to receive that information this week and receive offers accordingly. Also a reminder that January the 18th is a holiday and DCPS will be closed to observe the Martin Luther King Jr. Day. Also, January the 19th is a day out of school for students and teachers. And then also on January the 20th, we celebrate Inauguration Day, and DCPS is also closed on the 20th. We will begin our building readiness walkthroughs for our secondary schools only that will be opening for the first time, and that will occur between January 21st to the 25th. And then the week of January 25th, that is our target date to begin our vaccinations for staff that are working in person. It's also important to note that the testing protocols that were shared earlier are subject to change based on our vaccination implementation plans. On the week of January 25th, we will also close out our term 2, and teachers will begin to close out grading. And then term 3 schedules will be available in Aspen, which is our student information system where families can access grades, report cards, and also student schedules. On January the 27th at 5 p.m., we will return for another term 3 community town hall. And then January the 28th is the last day for term 2. And then schools would have been, at that point, shared all of their asynchronous learning plans and professional development for teachers. There's no school for students on January the 29th. And then on February the 1st, we begin term 3.
Thank you, Chancellor. We can get started on some question and answer now for the portion of the program. I do want to make sure that I remind everyone, if you're joining us by phone, you can press 0 now to be entered into the question queue. And if you're watching online through the Facebook or Twitter stream, you can ask your questions directly there. And I'm actually going to start with a question online. But again, for those on the phone, I know we had a very thorough and very informative presentation by our DCPS team, so thank you, Chancellor, and your staff for that very great presentation. So I want to make sure we have some time for questions, so please press 0 now to be entered into the question queue. The first question is coming online, Chancellor, and a resident is wanting to know, again, how were teachers engaged in the planning process for term 3 at the school?
Thank you. So teachers are a part of our reopening community core. So teachers have been participating. I had the pleasure of joining several of the reopening community core meetings at schools. And it was great to hear teachers providing input and feedback into the plans for their individual schools. We also have been in regular communication with the Washington Teacher Union, who represent our teachers, and proud that we were able to establish an agreement for our in-person learning and reopening plans with the Washington Teacher Union.
Thank you, Chancellor. We're going to go to our next question from Laura Darienjetter. I probably butchered that last name. I do apologize, Laura. From Ward 3. Laura, your line is unmuted.
Hello, can you hear me?
Yep, we can hear you, Laura.
Hello? Yes. Thank you. My question is that if there are schools that would like to primarily open using outdoor space and minimize the risk of having children and teachers indoors, how can they go about doing that if they need funding for that? Is there a way that they can ask for funds, or is there a fund that's going to be available for outdoor learning infrastructure? Thank you.
Yeah, we've encouraged schools to utilize outdoor space as much as possible, and some schools are currently utilizing outdoor space. Obviously, that looks different at each campus, but for example, I had an opportunity to visit an elementary school where they have outdoor learning, and they also have their meals served for lunch outdoor as well. And that is the preference for that particular campus. We're open to supporting schools that want to provide more outdoor learning space and time, and would be happy to follow up with any reopening community core team or school leader that is interested in expanding that option.
Thank you, Chancellor. We're going to go to our next question from online. It's from Nandini. The question is, will students with IEPs also receive occupational therapy, speech therapy, etc. in person?
Yeah, so we are working to provide as many seats as possible for our students receiving special education services. A good portion of our in-person learning includes self-contained special education classrooms. That is at the elementary and secondary level, and when possible, the goal is to provide as many of the related services as possible to those students that are in-person learning.
This next question is also from online. The question is, are school nurses also returning to schools as part of term 3?
Yeah, so school nurses have been working in person. The expectation through Children's National Hospital, who manages our contract with our nurses, they have been supporting us through our current reopening plans, in addition to assisting schools with vaccinations and other healthcare needs for schools, whether those schools have been providing in-person learning or not.
Thank you, Chancellor. We're going to take another one from online, and just want to remind everyone, again, if you're on the phone, you can press 0 to be entered into the question queue. The next question from online, Chancellor, is if you can just discuss the asymptomatic testing of students, again, and teachers.
Yeah, so Dr. Elliott can speak more to those details, but essentially at the school level, students have the ability to be tested approximately every 10 days on site when they have a valid consent form on file, and then our staff testing is a weekly mail-in testing format. I'll turn to Dr. Elliott to provide any other additional context.
I think you about have it, Chancellor. I guess the only thing I would add is that for the student testing, those results are communicated both to the school and to DC Health. And so this does give us a great opportunity for some type of surveillance in our schools, so we are able to respond very quickly when we have a positive test result. And also want to remind you that we are operating with great transparency, so anytime that we have knowledge around a positive result, that information is communicated to our students and families that might be close contacts, but also more broadly to our entire school community. So these are cases where we have any positive cases for students that are attending school for in-person learning. We broadly we communicate that information to the staff and school and family communities.
Thank you. We're going to take another online question, again, about protocols for if a student tests positive. So this is from Victoria joining us online. What is the isolation protocol if a kid tests positive? Will the classmates be automatically tested? Will the kids have to isolate at home? Will the families be notified? What is that process?
Yeah, sure. So if we have notification of a positive case, yes, we follow up with, in fact, DC Health will follow up with any close contacts, and they have that very clearly defined. So that would be anyone that has been in close proximity for more than 15 minutes or closer than 6 feet. So they follow up with anyone that is a close contact, and based on those interviews that they do with folks, they make a determination of the length of the quarantines. So as a district, we have a length of quarantine right now that we're focused on for 14 days, but we do our best to align with guidance coming from DC Health after they've done a deep investigation to determine the proximity of close contacts to the person that may have been COVID positive.
All right. Thank you so much. I want to thank the Chancellor and his team for joining us this week for our Community Leader Call as we talked about Term 3. I do want to remind everyone that for all of the most up-to-date information and resources related to the district's COVID and coronavirus recovery and response efforts, you can go to coronavirus.dc.gov. We will have another community town hall on Term 3 on January 27th at 5 p.m. We will not have our community leader call next week, so there will not be a call next week, but on Wednesday, January 27th, at 5 p.m., we will have our next Term 3 community town hall. I do want to thank everyone for being here with us. And again, that website is coronavirus.dc.gov. Thank you so much, and we'll talk to you on January 27th. Thank you.